Aloha everybody, my name is Carli Denis, and today I will be presenting you an informational speech pertaining to primary care asthma treatment and opioid usage. And while this study was conducted a couple years ago, it is still very prevalent to today's time, especially during the COVID-19 pandemic, where people or patients are struggling to get medical care that is essential to their life. Okay, so first and foremost, we must gain a basic understanding or introductory concept pertaining to what exactly is asthma and what are opioids. I will not lie to you, this discussion or information might be a little bit doom and gloom, but in reality, so many people are diagnosed with these conditions that it just has to be common knowledge and accepted. So first and foremost, what the heck is asthma, and why should I even be concerned about this? So essentially, asthma is a medical condition that leads to the constricting and tightening of bronchioles or your airways that usually will require medication depending on the severity of the case. And you're probably like, we are not all nursing majors. What the heck is that? Basically, you cannot get in air or air out efficiently. And this can lead to even more complications considering that many anatomical processes require oxygen. With that information in mind, about 1 in 13 Americans have a very severe case of asthma. And this is very important to understand that sometimes medical intervention is needed, this pertaining to corticosteroid inhalers as pictured above, as well as oral medication, but of course this depends on how severe each case is. So now that we understand what asthma is, what the heck are opioids? So opioids are substances that are typically prescribed as medication in order to treat medical conditions. This usually including hydrocodone and morphine, and it usually helps or aids in pain relief. So, unfortunately, while opioids are efficient in pain management, they do have addictive properties. That is why you see such as heroin mentioned above, because it is an opioid. And about 5% of Americans have admitted to opioid abuse, which really entails that they are using it outside of prescribed methods. So now we have to evaluate why this is concerning. And there are multiple components to it, but I will be mainly going into the physical and mental components just because it's easier to digest and break down. So in a physical sense, inhaled opioids such as heroin can further cause damage to the airways, and considering that you already have complications for the patient in this sense, complications with the airway and breathing, it will just further worsen the situation and lead to chronic obstructive pulmonary disease, or COPD for short. And of course, mixing prescribed and unprescribed medications can lower the effectiveness of the medication prescribed to patients, worsen their condition, or it could actually lead to an overdose. So now that we understand the physical complications that can arise, we must address the mental ones as well because they are equally as important. So now that there's a general understanding that opioids have addictive properties, what comes next? Well, unfortunately, a large majority of people do become addicted to these drugs because they associate it with pain relief and a good feeling of highness. But exempting that, people fail to realize that addiction is a disease to that equivalent of cancer. And I know that might seem a bit outrageous because they are two very different diseases, but considering the amount of medical intervention, treatments, counseling, and so many other components that go into diagnosing, treating, and understanding these diseases, it is equivalent and it needs to be treated as such. So now that we understand the different components that occurred in this study, we can now evaluate what came out of it. So it was essentially found through a primary care database that men of depraved neighborhoods, and specifically minority groups with a history of opioid use disorder, failed to get proper medical intervention for their acute asthmatic cases. Unfortunately, from this study, it was also revealed that due to an individual's usage of opioids and their addiction issues, it led to higher rates of opioid inhales usage, which then led to more cases of COPD or chronic obstructive pulmonary disease or some other form of obstructive airway complications. So now we need to discuss the concept of why should we even care? Because a lot of people have this line of thinking, which is justified, that if this is not happening to me, this is not my problem. But unfortunately, it just feeds into the system that is already in place that really criminalizes and undermines the well-being and healthcare of those in need, especially those people in need pertaining to those of minority groups and depraved neighborhoods that simply do not have access to proper medical care. So, in addition to these depraved groups and these minority groups, we now have a new issue pertaining to the COVID-19 pandemic that has simply heightened this issue even more so. Due to the pandemic, many people have been turning to substances, whether it be alcohol, opioids, recreational drugs, whatever it may be, but the abuse of such substances has increased exponentially and dramatically. Fortunately, in some neighborhoods, there are nonprofits that are set up with the sole purpose of reintegrating individuals with addiction issues into society so that they have a chance to live a fulfilling life. Unfortunately, this exposes the inability of our government to properly provide universal health care regardless of our financial complications that may arise, especially that during the COVID-19 pandemic, where millions of people were laid off due to lack of work or inability to work. And furthermore, there should be a reintegration or revitalization of the government's priorities pertaining to healthcare so that it can effectively benefit all of those people in the end. As my final closing statements, I would like to offer this. If you or anyone that you know are struggling with addiction or substance abuse disorder, please reach out for immediate medical attention. Do not hesitate to reach out. Addiction is a disease, and it is becoming an epidemic in the world that needs to be dealt with immediately. If you would like to contact a hotline, 1-800-662-4357. One more time. 1-800-662-4357. Addiction is a serious issue that will prevent you from flourishing in society. Please do not hesitate to contact someone.